the vast majority of hospitals were owned and controlled and founded and established by physicians. And physicians had not just control of, but responsibility for the care delivered and the price attached. So when the Hill-Burton Act was passed, which was a disaster, that shot community hospitals in every county almost in the United States. And that was very disruptive. It was hard then for the real hospitals, the one for which a market had been established to compete. And then we started to see this sort of corporatization and government takeover of healthcare. It really began with the Hill-Burton Act, which put community hospitals everywhere, even where they weren't needed.
Well, I think we see the remnants of that now, where there's some community hospitals in towns. They're really struggling because they're in towns that should never have been placed there in the first place.
There's not a market for it.
Right.
How would you know?
Right.
Yeah.
And yet it's a government hospital essentially, so they're never going to close, but they're losing millions of dollars a year. There's instances of that all over the nation.
And I don't think it's any mistake that Medicare passed subsequent to Hill-Burton, because now you've got all these government hospitals. Well, they don't want to charge patients. They want to plug directly into the trough.
Right.
So I don't think it was a coincidence that, well, we've put all these hospitals out there. How are we going to keep cash flowing through them? Well, let's just create a big government entitlement and let them plug into it. And that's what happened. Right now, rural hospitals are struggling, partly because there may or may not be a market for them. One of the main reasons they're struggling are these big city Death Star hospitals that go into a small town, buy up all the primary care practices, and then upon threat of termination, tell those docs, you have to refer to the mothership. And eventually they choke that hospital out, and then they buy it for a song, and then they control that rural area too, and just turn that little hospital into a kind of a way station on the way to the Death Star. There's that going on too. And of course, the federal government is subsidizing all of this.
Yep.
So it's just, and then people look to the government to solve healthcare. You're like, this doesn't make any sense.
They cause the problem, right?
Absolutely.